It's the one of the nurses strike here at the Kwesimintsim Government Hospital. And after moving around, what I can say about the situation here is chaos under control. I say this because, I mean, you move to consulting rooms and you see people like nutrition officers, HR, and others, assistant, physician assistants, and where there are doctors as well. And even as we are here, I saw an emergency being brought in, no nurses to stabilize a person before being taken to the next steps. What I saw was an admin assistant helping to convey the patient to a consulting room. This is what is happening here. When you go to the OPD, there are no nurses there. When you go to the antenatal, there are no nurses there. The dental facility, all the all the places where they have daily activities, patients come in daily, you will find no nurses there. Even as we speak, I've seen babies being brought in for their vaccinations and other care, fresh babies, and they have to be turned away because the nurses are not here. I interacted with one such mother.
To my surprising, when I came, they said they are on strike. The nurses are on strike.
So what do you intend to do now?
Seriously, I don't know. I don't know what to do right now. And it's important for my child to have the vaccination on 6 weeks. So right now, I'm confused.
I've also been speaking to the medical superintendent, Dr. Ose Frimpong, who seems to be at his wit's end. All that he's saying is that government should please quickly intervene to deal with the situation.
It's not an easy situation at all. I think whatever should be done to let them come back should be done. Otherwise, if there is any problem with the patients, it falls back on the facility. Let's assume a BP wasn't measured well and the patient suffers the consequences. The patient can come back to the facility that you didn't take good care of me, and we will suffer the consequences. So I think whatever should be done for the nurses to return, I would ask for that. Yes.
Earlier on, I spoke to the HR manager here, who is also assistant in one of the consulting rooms, and she explained that earlier in the day, around 7:30, there were rotational nurses around, but she saw them leaving, and when she inquired, she was told that they can only work under supervision of the nurses.
The nurses were here in the morning. I came in here around 7:30. They were here. But according to the information I'm getting now, they are saying they have to work under supervisions. So at the moment, I don't see them around here. Yeah. So they are not working.
What impact is it going to have on the administration of this facility?
Huh. In fact, it's very difficult. That one, they have to say it. Without the nurses, it's something because the nurses have to take care of them before going to the doctor. And as at now, if you don't have doctor and the nurses here, it's very, 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 very difficult.
So it's important that government quickly intervenes to address the situation because we know of the mpox and all that are all lingering around and the importance of ensuring that they are controlled. Irama Smith, TV3 News, Kwesimintsim Government Hospital.